Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Reason One, welcome and thank you for joining us for Beacon of Hope, navigating brand and trust through healthcare transformation. Periods of transformation, whether driven by acquisition, digital modernization, rebranding, leadership change, or strategic realignment, put extraordinary pressure on healthcare marketing teams. Leaders are expected to align stakeholders, protect trust, and communicate clearly while systems, teams, and priorities shift beneath them. Beacon Health's recent acquisition of Ascension Healthcare System in Southwest Michigan offers practical lessons for any marketer navigating complexity, change, and heightened stakeholder expectations. Here to share those lessons are Kate Newbold, Director of Digital Design and Customer Experience for Beacon Health System, and Larissa Towns, Strategic Account Manager at Reason One. Before I turn the program over to Kate and Larissa, one quick note. If you would like to ask a question, please enter it into the question and answer pane on the bottom of your screen at any time. Our speakers will respond to as many questions as they can in the time we have. With that, let's get started. Larissa, why don't you kick things off?
Thanks, Daniel. Thanks everyone for joining us today. I'm excited to get into everything that we have to share with you all. So we can start with introductions. Kate?
Wonderful. Good morning and good afternoon to everyone on the webinar. I'm Kate Newbold. I'm the Director of Digital Design and Customer Experience for Beacon Health System. Beacon's located in Northern Indiana and Southwest Michigan. You'll hear all about that during our webinar today, and I am part of our broader marketing team.
I'm Larissa Town, Strategic Account Director here at Reason One. We're a full service web design agency dedicated specifically to healthcare. And my team's had the pleasure of working with Kate on a few projects. So we were very intrigued when she approached us with this interesting opportunity to work on a secret project like this. So today we're here to talk and share a unique story that isn't actually all that uncommon in the world of healthcare. And I say that because if you're in this room or on this call, you've probably either been through an acquisition, you're in the middle of one, or you're kind of quietly wondering if there's one on the horizon. So the digital implications of that moment are something our industry doesn't talk about nearly enough. And that's really why we're here today. Here's the thing. When a merger or an acquisition happens, there's a lot of focus on the clinical integration, the operational logistics, the financials, and that's all rightfully so. But the patient-facing digital experience often gets treated as an afterthought. And yet it's one of the first places a patient goes to make sure and make sense of what's changed. They're Googling, they're trying to find their doctor, they're trying to log into a portal that may or may not still be working for them. And that experience can either build trust or erode it, and it happens very quickly. So we're going to walk you through our experience of an acquisition that required a quick turnaround, undefined requirements due to confidentiality, and some lessons learned, as well as the outcomes of all those coordinated efforts. And the confidentiality piece is real. And that's where Kate and I were operating with very different levels of information for quite a while, which created its own set of challenges that we'll get into. But my team at Reason One was involved in aspects of this acquisition just a few months out from the official handing of the keys. So I'm going to pass it off to Kate to set the stage on how we got to where we are today.
Great. Thanks, Larissa. So Beacon and Ascension, right? Two different health systems operating next to each other in the Michigan region, but really had to kind of get to know each other very quickly because big change came really fast. So Beacon was formed as Beacon Health System in 2011 from two different healthcare systems in the Northern Indiana region that had been in their communities for over 100 years. Our two flagship hospitals built in the late 1800s, early 1900s, had a really strong community presence. And we had worked since 2011 to really socialize and make that brand name strong for Beacon in the market as the place you go for the most excellent regional care. Our original footprint included 146 outpatient care sites. This included 7 hospitals that was the result of a few different small acquisitions that we did from 2018 to 2022. So in 2018, we acquired a small hospital, critical access hospital, community hospital of Bremen, that we brought on board. And then in the early 2020s, we brought on board Three Rivers Health System, which is our first venture into Michigan. And that brought with it about 10 different outpatient sites as well as a hospital. So we had started to make some of those forays into Michigan just a little bit, but still very close to our border, still very much wrapped into our community. Ascension Michigan Southwest, on the other hand, they really operated a little bit more sort of, you guys know the paw, really kind of north and pretty close to Lake Michigan, you know, tens and in some cases hundreds of miles away from where our center was. They had 4 hospitals, 35 outpatient clinics, an ASC, and a fitness center within this Southwest Michigan footprint that we acquired. So this really pretty significantly changed our size to up to 270 total care sites, 10 counties, and 2 states. So we had to get our arms around this really, really quickly. So how did we learn about this, and what was our timeline? If you wouldn't mind the next slide, Larissa. So this was the true timeline. If it seems quick, it's because it was. So from December 2024 through about February 2025, key marketing leaders and individual contributors were notified of this acquisition that we were intending to complete. And we had to sign NDAs that specified we couldn't talk to anyone about what was happening, right? And only the folks who were brought on board at this point were brought on board for specific purposes. And within the marketing world, there were several activities going on. For me and my team, one of our main activities was really creating a web home for announcing our intent to acquire. And that intent to acquire was a really important period of time that we're going to talk through today, where we wanted to signal to the community that this acquisition, we think is going to be great for the region. It's the way to sort of build our case. And it's also the way for us to really show what a bright future we have ahead in the region. And that's what we called our landing page that we developed, Bright Future. And we launched that on April 1st with the intent to acquire. And that is when we could finally notify all of our marketing teams. And that's also when we could finally notify Larissa and team what was going on. I had connected with Larissa and Ben from Reason One a few weeks before that and said, hey, we've got a project. We've got this thing that we can't tell you about, but we know it will involve content. We know it will involve some of these resources. So can we connect and can we try to do a kickoff as soon as possible after April 1st for this project? And they got ducks in a row incredibly fast. We're great partners to work with. And we started that kickoff on April 3rd with them to bring all of that web content over and do all of the pieces that we needed to by July 1st, when we announced that we had officially acquired this Southwest Michigan region of Ascension. We had to have all of the web content finalized on our websites in that 90-day period. So it was quite a quick move. A long way to go, really short time to get there. You could go to the next one, Larissa. So these represent just some of the buckets of activity that we had to consider during this project. And we'll talk variously through some of these and some of our strategies behind them. But really, as we began this project and as we kicked off, there were 3 areas of immediate focus that we knew were going to make this project a success if we could do them and if we could tackle them in the right way. And the first was really around geolocation and personalization. And you see that on the right-hand side of the screen. Prior to this, we had, as mentioned, really been an Indiana system with just a small footprint in Michigan. We were now going to be a fully 2-state system. And what that meant was we were going to have folks in both areas that really only wanted to see content, providers, locations, services that was most relevant to them in their community. We hadn't had to do that before, right? That's getting down the path of a degree of personalization that we had not had to deal with. So how do we think about that, right? That was one of our first considerations. The second was content and the sheer amount of content that we were going to have to bring over from the Ascension side. And we had rules around what we could sort of bring over, right? And what we had to fully rewrite in order to then put it on our website. So we had to think through and understand all of that content, and Beacon needed help in actually writing some of that and making sure it got in the right places on our site because we were not staffed such a short period of time to do all of that legwork. So Reason One was really a fantastic partner on that. And then the third was, once you have this content, do we need to wireframe up some of these sections differently? Do we just integrate the content in? How do we think about that strategy and what makes sense? We'll talk through that today. One example I want to point out here on the screen is you see health and fitness. And our health and fitness sites had a really strong brand recognition in our markets, and it was a brand identity that we really wanted to carry through in Michigan. And it was also laid out in a way from a consumer perspective that we thought lended itself well to the new health and fitness location that we had just acquired. So in that case, we really chose to bring that content in and integrate it into what we had already developed with some minor changes, but that's not the case with some of these other ones that we had here. So we'll talk through all of those, but early on in the project, a lot more unknowns than knowns. So Larissa, I'll hand it back over to you.
Yeah, so I guess the question is like, how does an agency or really any partner approach and plan for a project with so many of those unknowns, right? We didn't have that luxury of a defined scope or requirements timeline, like you saw in the last slide. Like none of that was really defined yet. And I want you to sit with that for a second and like really think about it, because it's a stranger feeling than it sounds. We're a team that's used to ambiguity, that's part of the job, but there's a difference between the requirements aren't fully defined yet, and we genuinely can't tell you what this is all for. So that's kind of what we were working with. And we had a start date, a vague shape of work, and a client that we've worked with before and we trusted. And that was pretty much it at that point. So up until kickoff, all we knew was that there was a project, and that information would become available to us around April 3rd. And that was when we would need to staff a team to help guide strategic direction. It may require changes to the site layout, some nav changes, significant revisions needed on several pages, and then those large additions of pages and content to be added to the site as well. So how do we even begin to allocate resources or put this kind of scope together with such ambiguity? And the first thing we did is we took what we knew, and based on what we'd heard, which reading between the lines, Kate did a great job of managing with discretion, but we'd come up with a couple of different scenarios of what this project could entail or what it could be for. Luckily, an acquisition was one of those scenarios that we had planned for. So we didn't know exactly what the specific ask was. We knew if we had some of our strongest people in the room that we could figure it out together. And honestly, a big part of why we felt that was true was because of the relationship that we had built with Kate. We weren't starting from zero. We knew how she communicated. We were somewhat familiar with their dev environment. We knew how her team operated. We trusted enough to work and have an honest conversation, even when she couldn't give us that full picture. And that foundation, I think, matters a lot more than we realized at the time. Because when you're working under these constraints, being able to kind of work through that it's just invaluable. We had a quick session with Kate to just kind of go through some clarifying questions, some that she could answer, some that she couldn't, but that helped us outline what could be possible and what possibly would be needed from us, and how much effort that would take. So essentially, we created a rough estimate that would be validated against the work that we planned once the project kicked off on April 3rd. And that was just scheduled, just a couple of days after that announcement of intent to acquire was made. So that's where our parking lot came in. Once we understood the full requirements, anything that wasn't critical to launch went into a documented backlog. It wasn't like thrown away, it was just set aside intentionally. And that's not just like a nice to have list. It was something that helped us keep the team focused on what actually had to ship, while ensuring that no good idea was overlooked or kind of forgotten about. So as the teams or stakeholders came up with ideas or thoughts that, hey, we would love to see this feature, or we're thinking about doing this, we had to ask, like, does this benefit the launch date? Is this something that's really important for today, or is that something that can be a fast follow? And once we developed that parking lot or that backlog, it also gave us something to hand back to Kate and say, like, here's what we should be doing next. And that's really, again, a valuable thing to have in a strategic partnership like we did. So one of the things that we knew for sure was that this deadline was not able to be moved. And we asked, and she was like, nope, no iterative processes. Everything has to launch within a few hours on this day. It also happened to land on one of the most popular times of year for PTO, which was July 4th, the week of that. So that meant our timeline was probably actually even shorter than we originally thought. So the day we kicked off and we understood what was happening, we began to strategize on how can we make this as efficient as possible? Can we migrate loads of content programmatically? Can we batch edit the provider photos just to get the Ascension logos out of their white coats, and update that cohesive branding? In general, like what can we do to reduce the manual effort and avoid too much risk in those final hours? And this is the reality of acquisitions. It's, a lot of information you need just isn't available on day one, not to us, and honestly, not even to Kate's team. Even once we knew the what, we were still working on piecemealed information coming from Ascension and stakeholders from across both organizations. And that's just how these things naturally unfold. So people were learning in real time on both sides. Some of the folks we needed information from were just themselves finding out the full scope of the project of what was happening. So you really have to build in some patience for that. And you have to have a team that can make some smart decisions with incomplete information and course correct when those new details come in. So while Beacon's team was gathering some information for us on the back end, my team began to ideate on some of those opportunities that Kate just kind of highlighted that would help smooth the acquisition from a digital perspective. We knew that there was a larger redesign further in Beacon's future, but we had some challenges that we needed to address now to bridge that gap between this acquisition and whenever that new site would launch. So we gathered some strategic ideas and put them into a strategy doc to share with Kate's team really early on. And they outlined several key recommendations that would impact the homepage, patient portals, patient and visitor pages, and many more things.
Yeah, thanks, Larissa. And that strategy document was a really critical component of how we collaborated together throughout the entire process, because that was sort of our stake in the ground to say, this is going to guide our decisions. That's how we keep the scope manageable, right? While still finding those small opportunities to improve, right? And to make the journeys easier for everyone, but really kind of guiding all of the work that comes after it. So really critical deliverable early in the process that really outlined some really important things that enabled us to sort of focus on, okay, here's the work that we're actually going to do, right? So you will see us kind of talk through these in more detail in the slides that follow, but to hit them high level, our homepage really needed a much different sort of approach that involved not just geolocation, but really surfaced up a common tone for everyone who's coming to our site, right? We knew that folks that would be coming July 1st, July 2nd, July 3rd are sort of from the new market wondering what's going on. And our existing customers that may be coming to our website, we want to introduce this to them, but reassure them, right, that their care is going to continue. So how do we think about that, right, in the structure of the page? Geolocation needed to be in several places, but it's a huge topic to think about infusing that throughout your site, right? I mean, we're talking deep integrations to other systems that wasn't in scope for this project. So we really picked out what are those key areas that we want to focus on for geolocation that's going to really get everyone in the best position, right, to really leverage those and to find some quick value out of them. And then how can we think about putting some of the parking lot items over there and just knowing that those would be future state enhancements. So those were some early critical ones that we did. And then we had 3 pages in particular that got a lot of wireframe and design focus because we found that they needed to be substantially different from what we currently had. And that was patients and visitors, our patient portals, and our bill pay page. And all of these needed some different work for different reasons. For those of you who have maybe done this before, who work a little bit more on the technical side, you may know that portals and bill pay, anytime you do an acquisition, you're bringing in additional portals and additional bill pay pages for a period of time, right? So our design didn't account for that. So how do we think about that, right? Patients and visitors was another page that just had not gotten a lot of love lately, and this was a great opportunity to really rethink how we structured that page and make it usable for all. So, Larissa, I'll hand it over to you to talk about the homepage.
Yeah, we can walk through some of things. Thank you. So the first thing to tackle was the homepage. We know that this is literally the first page that most of these people, either returning users or new users, are going to be visiting on by the time they hear about this acquisition or any changes. So we had a few goals that were table stakes for this initiative. We needed to convey trust and continuity, not only to those new patients, but again, to the existing users as well. So we created some wires to support our recommendations that included an improved hero section, welcoming all the users and sharing that expanded footprint of Beacon's services. And then this bubbled up some of those larger opportunities, like how do we keep the website user-friendly to folks new to the Beacon brand? So we prioritized some high engagement CTAs, like this, the find a docs and locations, just to reduce the friction of the navigating site. And with this acquisition, as Kate had mentioned, Beacon was becoming more established in states or in Michigan where they just had a toe in the door. So we considered how to highlight locations near where the users were visiting from on the site. So that's where we came up with that personalization strategy with the net new geolocation feature to literally meet patients and users where they were at. So on the homepage, we added a section below the hero to invite users to personalize their experience by setting their location. So giving them this to them as an entirely optional feature would increase the ease of use in a way that a user would expect a website to operate and behave, right? But it was also compliant, which is not an easy thing to do in the healthcare site these days. So it was really important to us that we introduced that geolocation personalization both clearly, but also respectful of the privacy of the users.
And Larissa, if you don't mind, I'll just add a few things to that, because this was such a collaborative space for us to work well together. And I think we learned some things on the Beacon side that really took us even beyond just this project. So when we first started on this project, our homepage had a rotating carousel. And the thinking at the time from Beacon was, well, then we can put many CTAs, right, and many stories kind of front and center. But what we were finding was that carousel had incredibly low engagement, right? It wasn't really working for us in the way that we thought. And what we were trying to introduce in this process was really stability. So Larissa and team did a great job of kind of focusing our team on what's the message, right, that we really want to send here with what we're introducing. What do we need the tone to be? And how do we want to guide patients to do these actions, right? That's what I think made those CTAs such a important part of the experience. And you will see them as we show later on, that it's not just showing the new market what we have available to them. It's also reassuring the folks who are still Beacon patients, hey, we got you. Like you can click on any of these and continue to do the business exactly as you have done. Just because we are expanding doesn't take anything away from you, right? So those were really important, I think, points of collaboration that we had with Reason One to highlight the correct tone that we needed to for this page. Thanks, Larissa.
Yeah, very true. It's very true. Another page that we overhauled was the patient and visitors page, as well as the supporting subpage nav. And this is, again, one of those pages that's really worth paying attention to if you're thinking about an acquisition, because this is often one of the very first pages that a brand new patient or user visits when they're trying to figure out what a health system is like. It's a trust building page as much as it's an informational one. So the first question that we all collectively asked is like, what does a user actually expect to find here? We observed, as Kate alluded to earlier, that this page had accumulated a lot of content over time. It needed a little bit of a refresh. The content on there was all very valuable content, but it had gotten just cluttered enough that it was challenging for a user to really find what they were looking for. And that's when you're adding a whole new patient population who's never interacted with your brand before. That clutter can become a costly thing. So our goal here was to really streamline that visual noise, create more of a true landing page that helps organize users to navigate what they're looking for, but also it also meant a full visual refresh. So reorganizing that content just to be more intuitive, the addition of a hospital location widget that carried over the user's location if they'd already shared it on the homepage. So if you told us you were in Michigan on that homepage, that geolocation kind of carried over and we remembered that. So it helped make the experience feel more connected and not disjointed, which is exactly that kind of continuity that's going to build some quiet confidence in a brand. We also updated the subnav here. That was just to organize those headings so that users weren't just scrolling through a long, undifferentiated menu. And we organized the page content where someone was in their journey, kind of just met them where they were at. So there was their first time planning a visit, if they were currently visiting, or if they were looking for some aftercare resources. We had all of that laid out very clearly in our headings so that these three different types of people and users could have their different types of needs met. And that page was there to reflect that. So one other thing that we did above the fold is we made sure to link the patient portal and made one that to be very prominent. And that page had a lot of weight to carry, which I'll share with you in just a moment. But Kate, is there anything else you want to add here?
No, I think you've covered it. And truly we've seen much more engagement on this page since we've done those, and clear engagement, which then allows us to maybe do some different things with this site in the future. So
yeah, so let's get into that patient portal because that is very important. So when you acquire a hospital network or like any business, it's not like flipping a switch, right? We have provider management systems, EMRs, loads of integrations that have to not only be streamlined, but often adopted by the users you're acquiring. So user trust and continuity is really going to be important to establish day one, which is why the patient portal page for Beacon now needed to house, at least temporarily, several distinctly different patient portals, which is never fun. So this was an example of some of the short-term digital strategy that we had to implement while Beacon's internal team organized and fleshed out the longer roadmap to consolidate those portals, which that could be its own topic for another webinar, truly. And I think we've made some leeway with that. So if you check out the new patient portal site, you won't really see this wireframe reflected because Kate's been doing some hard work since that acquisition. But the opportunity that we identified here was to take what could easily become kind of a confusing black box, the kind of page where users are going to click out of and click away from. And we wanted to make it genuinely navigable. So we improved the overall structure of search and scalability. We built in some clear wayfinding so that users could confidently get to the right portal that was the right one and relevant to them. And then we also used this moment to drive adoption of that My Beacon app with some guidance on how to download it, what's it for, how to get started, and then a CTA for their mailing list, just to give Beacon a way to stay in direct contact with users who are navigating a lot of changes at one time. So we've tackled some of the most important things tied to patient care, but there's still a really important page that needed to be addressed. And that is how to pay your bill. Definitely not the most glamorous thing that we'll be talking about today, but honestly, it's one of the most important things to get right. This isn't a page that users want to face any friction. Nobody arrives at a bill pay in a great mood. They've usually just had a healthcare experience, they've received something in the mail, and then they just want to sort out the financial side of it. So the last thing they need to do is land on a confusing page. And that was exactly the challenge. When your bill pay now has to route users to, I think, 3 different billing systems, depending on where they were being treated, you have to be really intentional about, every decision on that page. So, we ran every single decision on this page through the same filter. Is this easy to find? Is it easy to understand? And is it easy to act on? So we updated the layout using existing components to create that more cohesive experience. We improved the usability and the readability, of course, on both desktop and mobile. And then we added some accordions to organize the information more cleanly, which really kind of sounds like a small thing, but it makes a really big difference when you're trying to present, again, 3 different pathways without overwhelming someone who just wants to pay their bill and move on. We also added a direct link to the My Beacon payment portal in the hero, so it was impossible to miss. And we built in some routing cards that helps users more quickly land on the right billing page for their situation. So at this point, we've identified and addressed a lot of changes, and all that was left was like the how do we get to the launch. So Kate, do you want to walk everyone through our launch plan and share where things were headed from here?
I would love to. Yeah, absolutely. And we'd been working fast and furious to get everything together. Weekly, bi-weekly meetings and working sessions as needed, right? Connections with other folks from our marketing team, and the few connections that we were able to have that really came from the new market. So all of that was sort of leading up to what we really called kind of our launch week, because as Larissa noted earlier, July 1st is a holiday week. And so many folks, even though our launch day was July 1st, we know that we had folks that were going to be out of office, and we had to accommodate that. We also had pieces that could be done in advance and pieces that had to be done day of. So looking in advance, we really tried to do as much as we could, June 24th, 25th, kind of towards the end of that final week, just to get everything prepared. So got our homepage hero ready to go, a visitors landing page ready to go, all the patients and visitors subpage, our portals, our billing, right? We got all of those pieces really ready to go in dev deployment QA so that we could launch those. One thing we did launch early, because it wasn't a dependency on the acquisition being finalized, was the geolocation strategy, right? So we actually launched that at the end of June, and it was sort of a great little early test to see how well our consumers really liked it and how much they used it. And we got some really encouraging early use and adoption of it, which really made it a helpful kind of tool and a little preview to know, okay, this could be useful for others as well. So we were able to launch those things in advance. Then July 1st hits, and we are having things in really that our book of play that day really had things almost divided by the half hour. And there were a number of communications that had to go out at the right time. And there was a bunch of work that had to happen concurrently so that these communications could go out, and so that if someone sees a website in a press release, when they go there, the content has to be updated, right? So our launch plan really for some folks started before 7 a.m., but for us started at 7 a.m., where we had to share with our boards and our leadership what was going on, right? Because remember, not everyone knew. Only folks who needed to know knew at that time. At 7:30, we then sent out separate communication to different associate populations and to our medical staff to notify them. At 8 a.m., we released communication to our community stakeholders to notify them of this. And then at 10:30 a.m., we launched what we called an updated version of our Bright Futures page, right? So that intent to acquire page became, hey, we have acquired, right? And then that is also where at 11 a.m., all of our other pages went live. So we had on our home screen, we had a really kind of beautiful graphic announcing it, leading you to that Bright Futures page. And that's when you started to see all these other components live. What was happening at the same time that day is in some cases, we couldn't just preload all the content and click publish. In some cases, because of the way our CMS is constructed, we had to actually enter that content in and then publish at the same time, which required some really coordinated logistics between my team and Larissa's team to make sure we knew exactly who was doing what pieces of it and at what times and what needed to be prioritized, right? So we prioritized, for example, some of the certainly the Bright Futures page, right? And some of those pieces on the homepage. Really wanted to make sure that patients and visitors was ready to go. Our services and providers and locations, all of that content had to be really ready to go. If we then published health and fitness, maybe just a little bit later, that's okay, right? Because we kind of put the focus on where it needed to be in that day, but everyone had sort of their marching orders for what was going to be published in that day. So by about 11, 12 o'clock that day, we were fully live across all of our sites, which was a really exciting moment. I think we did take a moment to celebrate and be excited about it, and really celebrate what was ahead of us. And it was the last deep breath before we sort of dove into some other pretty significant work at Beacon. But that was our launch plan for that day. And what's resulted is really a homepage experience, just to show this to you, that I think is much more robust and sends some stronger signals to our patients about where to navigate, right? Makes it easier for them. So this is just a scroll of our current homepage experience, beaconhealthsystem.org, beacon.health, if you prefer the shorter version. We refer to this as Prime. And what you see here on Prime, you can see some of those patient login, bill pay, right in the middle, personalize your experience. Some of those CTAs there, right? Find a doc. And then we show available services, providers, and then urgent care as well, right? Really making sure to kind of highlight some of those services and some of those locations. And that geolocation capability passes through all of these web experiences. We have some ideas for ways we want to extend that in the future, but this is really where we put a lot of early focus, because this is truly the front door of our system, right? This is truly how you are able to come into Beacon. If you're not familiar with us at all, we want to be able to introduce you to what we're all about, not just from a sort of tone and services perspective, but what you can expect on how to do business with Beacon. That was really important to us, that we really, really signal that pretty clearly. And this was just the beginning, right? So as Larissa mentioned earlier, we put in several items in our parking lot that we said, oh, these are really great ideas, but we do not have the bandwidth or the time to take them on right now. We know what we need to accomplish, but this is something that we want to save. Extending that geolocation, right, across all search and subdomains, because of the way we have our search set up and some of our other provider and location experiences, we have several other technologies that support site search and that support our care library and things like that on our website that are going to take some dedicated developer effort to stitch those experiences together in order to make geolocation pass through all of those different experiences, right? So extending that is going to take some more effort that we want to do as part of really getting further down the line of that personalization, right? Consolidation of portals. So we've actually already done this in some way. We, from July 1st to February 1st, we did the transition of all of our different EMRs, all of our different internal systems from an IT perspective, all of our clinical systems for that new market onto our sites. And so we were able at that time to consolidate our portals to one main CTA, which was, we've been trying to do this for many years. So that was an exciting moment. Still have the other ones available. But the way that we laid out the accordion structure of that page and the ways that we communicated about it with Reason One made that transition really easy. We didn't have to completely rethink the page. We didn't have to go deep on the language, right? We didn't have to think about, well, how do we show them the other portals in case they still need to access them? It was all already laid out for us. So it was a very easy adjustment. And that's one of, I think, the big things that we got from this project is some of that reconfiguration work that we did, some of those wireframes were really done with a great eye for current needs and then also future change needs that we had. Much more was in the parking lot that we had for this initiative, but then what really came out of this, we really used this project as a testing ground to say, okay, Reason One, this was great. Now help us figure out how to really rebuild our site from the ground up. And that is our web transformation initiative. It's a multi-year project that we've embarked on with Reason One. We started in earnest in November of last year, and we'll go through much of 2027 to really take some of these great things that we've learned from this project and really think about how are consumers going to engage with us in 3 years, in 5 years, right? How are they going to use AI? How do we need to be using it to really engage with our consumers, but still retain our Beacon brand and still make it easy for our customers to do business with us? That's our headline right there, right? Make it easy to do business with Beacon. And so this whole initiative that we've talked about with you today really laid some important groundwork pieces for us to be able to do this other project. And I would say top among them is the trust that developed among our two teams and between Reason One and Beacon to say, yep, you are the right partner for this, and we're gonna go on this journey together. So it's been a fantastic journey, and I think we've learned a lot from this process as well and from this project, right? And there's a couple different ways to think about some of these lessons learned, right? So you can think about it from a health system perspective or from an agency perspective, right? So from a health system perspective, if there is an acquisition in your future, right? Or even if you just want to be prepared in case one ever does come down the pipeline, couple things to keep in mind if you're a healthcare system or a provider. Identify that brand strategy early and quickly in the process. You have to know how you're going to need to talk to your new market because most of the time it's going to be different than the ways that you're talking to your existing market. So, for example, we have about 63% market share in our legacy, what we call our legacy market. And we've been there for a while. People know us, people know our name. We had about 11% brand recognition in our new market. And we knew that because there had been some work done from those in the know earlier in the acquisition project to kind of understand what our brand recognition was. Well, if you're really known in the market and you've got a significant market share, that's a much different communication strategy than if you are introducing yourself to a new market, right? So we really had to think about how we talk to both separately, but retain that brand voice, right? And in those moments, like on our homepage, how are we talking to everyone in a way that makes sense to everyone, right? You have to figure that out early and you have to know what that is because that's really going to guide a lot of those conversations that you have with your agency partner. The second is to take advantage of opportunities to improve existing experiences, right? So a great example of this, right, is our patients and visitors page. And that was one where, as Larissa mentioned, it was just, we just sort of threw everything in there, right? And let you kind of figure out what information was important to you. Because we were bringing on a whole new subset of people that didn't know us, it was a really great opportunity in a low lift way to organize that consumer journey in a way that made sense to everyone, right? So how do you plan for your visit, right? What happens during your stay? What do you need to think about after your visit? And then how can you share your experience with us? And you'll notice that that language is really consumer friendly, right? It's not sort of clinical. It's not, thinking about your inpatient stay, right? It's very much geared towards all folks who may be coming from, just a annual wellness visit, right? Through to I'm having a major surgery, right? Thinking about all of those populations, right? How do we speak to them? That was a really great example of a way in a low lift way that we are able to take advantage of an opportunity to make the whole experience better for everyone. By the same token, we did not try to boil the ocean. We were very disciplined, and I give Larissa and Tiana and the whole team credit for keeping us really honest on this. There were definitely times where we could have spun out and tried to do many more things just because we were excited about the possibilities. And that's truly a risk, I think, early on in the project as well, to really get excited about the opportunities and want to do that. Larissa and team kept us really focused on what needed to get done because our deadlines were firm. They were not going to move. So that is a really important tip to keep in mind. And then, of course, leveraging your existing partners or past collaborators. We had done 3 projects with Reason One on a variety of topics prior to us doing this. And we were able to really quickly reach out to them, get this started. They mobilized quickly on their side. And it made the process go so much more quickly than if we had to really start from scratch. Sometimes you don't have that luxury, but get creative and look around and think who you've worked with in the past that may be able to help you give you a leg up in these kinds of scenarios. Larissa, I'll hand it over to you.
Yeah, and you've touched on a lot of really great lessons learned that I feel like we learned as well on the agency side. Communicating often, that's like there's no such thing as too much alignment, especially when you're working with such ambiguity and information scarce. So like sometimes it can be tempting to like wait until you have something more definitive to share, right? But even just a quick, hey, nothing's changed, we'll see you on April 3rd, is better than nothing. Silence can kind of read as uncertainty, and that can be hard to hold some resources when you really just don't know what you need to do. So over communicating, especially when things are moving fast, is never a wrong thing to do. Also, just building that contingency into your plan from day one. We had a plan B, a plan C. We knew going in that information was going to arrive in pieces and that some of it was inevitably going to change. We asked a couple of questions and the answer might shift a couple of weeks into the project just due to the changing and moving parts there. So we built that flexibility into the timeline, not into the timeline, but we built it into the process. What can we build now without certain information? What has to wait? Where are the risks that we can engineer out early? Those types of things. Defining the MVP, intentionally building out the parking lot. Kate spoke to that as well, but it's definitely worth reinforcing. The pressure during an acquisition is to do everything all at once. That instinct is going to sink you for sure. So just getting aligned on what has to be true at launch, document everything in the backlog, protect that line. That parking lot keeps all those good ideas alive without blowing up your timeline. And then the small wins, they can have a big impact on the overall experience. We don't need to rethink and reimagine everything on day one. Geolocation, routing cards on bill pay, reorganizing the sub nav. None of these are big, splashy features, but together they're a difference between a site that makes a patient feel taken care of and one that makes them feel like they've landed somewhere unfamiliar. So don't underestimate the cumulative effect of thoughtful, targeted improvements. So that is everything we have to share today as far as our webinar, but we'd be happy to respond to some questions from you all now. Just a reminder, if you'd like to submit a question, you can enter it in the Q&A pane at the bottom of the nav. And we can, I think we have a couple of questions already. So let's see. How do you manage your team through the process? How do you manage information within the organization? Kate, I'd love to kind of hear how you managed some of the information and disseminating and determining when to disseminate that information.
Yeah, absolutely. So definitely think about this as a sort of before the intent is announced and after, because those were two very sort of different moments, right? So before, it's a lonely place in some regards, because you've got a whole team. I had at the time 8 people reporting to me, and I could tell one of them a couple weeks after I found out what was going on. I couldn't say a word to anybody else, and I couldn't, you can't like wink wink, something's coming. You can't do any of that, right? And please don't do that. So it can be a little bit of a lonely place, and you've got to kind of work your way through it, right? So making sure that I stayed connected to my one individual contributor, who is my senior developer, Edgar, who's just fantastic and always does such a great job of communicating and, making sure he understands the requirements. He had some limited folks that he could work with. So making sure that, he really understood, he's got to sign the NDA, what that means, and who he can talk to, and only those people, right? To make sure that we got that work done. And then knowing who internally at Beacon I could talk to was sort of another fun thing. I often had to go to my executive and say, can I talk to this person? Do they know? And often the answer was no, right? So sometimes you have to feel your way through that. The Ascension resources, even more limited, right? I think maybe 1 or 2 people prior that could be talked to, and I don't think I was able to talk to them. So that was sort of the pre-process. Post, I think there was some folks who really had no idea that this was coming, and generally speaking, I think there was an air of excitement. I think there's probably an air of, oh my gosh, what are we getting ourselves into, right? This was the largest acquisition we'd ever done. So there were folks on my team, since my team manages, in addition to what you see here, my team manages all of our digital consumer facing experiences, including online scheduling, including digital registration, a lot of other pieces for the system that weren't involved in this project, right? But they may need to know pieces of information from this project, but they might have to sit tight for a bit, right? Their work's going to get started soon, but we had to kind of prioritize this work. So it was really about sort of giving them, I think, consistent points of information, right? Making sure that they were in the loop on what they needed to know consistently, while reassuring them that their time would come, and boy, did it ever. So it's, I think it's really about just sort of being as transparent as you can be. And I also shared with them that there are things I cannot tell you, and there are things that I will not be able to tell you, and we're all going to kind of work with imperfect information. And that's sort of another, I think, overarching theme that you're hearing here is expect messiness, expect uncertainty. That's the nature of the beast. That's where it's so important, as Larissa has pointed out, to really be clear in your communications. Could never have too much alignment. Make sure you've got those plans, but you've got the plan B, C, and D as well as backup.
Yeah, that's great. Um, Another question here. How do you understand the non-negotiables, the scope, and the legalities? I'd love to hear your answer, Kate, and then I have a couple of thoughts too.
Yeah, I'd love to hear your thoughts on this too. Yeah, the legalities are a really tricky part of this. And often you don't have full line of sight into all of those pieces, right? So we had what's called a letter of agreement that we signed around brand activities and a few other pieces that really outlined the scope of at what times we were able to use the Beacon brand versus the Ascension brand. And that sort of governed also some of what content we were able to take from the website and some of those other pieces. And so that had to be followed to the T, right? That was a non-negotiable. And you need to understand those documents and spend time with them to really work through what's being asked of you, because they will come with very specific dates, and those dates are non-negotiable, right? So really making sure that you know what you're given access to. If you feel that there's something you need access to do your job, advocate for it, right? Doesn't mean you always get it, but that was a really helpful document that my team and I spent some time on to really understand as we worked through this. So I'd say that to me, I think was sort of one of those really important pieces. Can you remind me, sorry, in the question, what were the other
Yeah,
components?
so how do you understand the non-negotiables, the scope, and the legalities?
Yeah, I think the scope was a challenge. In some ways, we were a little bit fortunate because Ascension had three regions at one time within Michigan that they oversaw. They had a northern region, they had central, and then they had southwest Michigan. They had been going through a process of divestiture for a couple years from the Michigan market. So their northern region had already been divested. I think they were almost finished with divesting the central region. So the way they kind of had things on their site was divided by state. So when you went to see the Michigan content, that content was all just relevant to the market that we were acquiring, which was really helpful. But Ascension had some things that were locally managed and some things that were nationally managed, right? So their bill pay portal, for example, was applied to all of their regions, right? But some of their location pages and some of their services were more region specific. So we had to kind of navigate, in terms of scope, how we even make sure that we account for all of the pieces was something that took some time up front. And Larissa, I think you can attest to this, right? That there were a few times you came back and said, oh yeah, there's this thing too. And oh yeah,
Yeah.
we found this piece as well. And a lot of that was just due to the fragmented nature of all of the pieces that we needed to account for in that process. So it's a challenge, making sure that your team understands the ask as early as possible and really kind of works through that stuff is absolutely critical.
Yeah, and to that, I mean, I'll say, I know initially for us, understanding that those like non-negotiables, the scopes and legalities, you were kind of at the mercy of the information that we could even get at that point. So, April or in March, we weren't able to get much. April 3rd, we got a little bit more, but early on in the project, we asked some questions like, is this does everything need to be, whatever this is, does everything need to be launched on July 1st, or can we do like an iterative process? And Kate was like, no, everything needs to be launched on July 1st for what we were like the non-negotiables at that time.
Yeah.
And so some of those things were tied to legalities. Some of those things were no longer going to exist on the Ascension site on July 1st. So we had to have that content already kind of in the ready and in the back end. So those were some very heavily tied to timeline non-negotiables and also just legal requirements of their acquisition that we had no flexibility on. So we just had to work with what we had there. But also with the scope, I mean, to Kate's point, I think the messiness is like a feature, not a bug. So we again, started with an estimate of like, this is what we think it could be. And then we kind of right sized the ship. But having flexibility within that estimate gave us an opportunity to be nimble with that scope, at least from like if it's a relatively low lift, but it's something that could, improve the site or even just improve how we're migrating that content. I remember, at one point we were hopeful we would have some direct contact with the Ascension team. And then we found out a little bit later, no, actually, that's not going to happen. So we had to pivot to what we could get that information from. But at the same time, there were some positive things, some things we thought we weren't going to have access to that we ended up getting access to as information came through. So just understanding that you're not going to know everything and that you just need to be nimble and flexible, it just at the end of the day makes it a lot easier because you're not kind of going against something that you're never going to get to begin with. So I think from an agency side, yeah, it's really at the end of the day, like it's just about flexibility and knowing that you're going to have to you're going to have to do some things that may not be part of your typical process because this isn't a typical scenario. This is a very unique, big acquisition, biggest of Beacon's, and in a really short time frame, you're just going to have to roll with the punches there.
That's right.
I think we have time for one more question, and then I can pass it off back to you, Daniel. Let's see. Okay, Kate, this is another one for you. How do you fill the information, the vacuum of information, if you're not able to work with the acquisition team? I guess it's kind of for us too, but I am curious from your side, like not having direct all that information, like how was it? How did you fill that vacuum of information to share with us?
Yeah, no, it's a great question. I'd love to hear too how well that worked on your side because it certainly felt like a vacuum. And in some ways, we had Ascension sites that we could go to, right? And we could kind of see the content and the services and all of those things. And some point you have to sort of take a little bit of a leap of faith that those things are kept updated, right? And that
Yeah.
it's the latest and greatest. And it was, I think, in almost all cases. So didn't have too much to worry about there, but it was, if we had a question about a service, in some cases, I think we just never either didn't get answers right away and just had to kind of figure it out, or it took, I can connect with this person who can connect with this person who can connect with this person to give you an answer. It was a game of telephone, right? To get some of those. And we did have those, right? Most of the services that we brought on were the same, but we did have a few and had some questions about some of the procedures and things like that. So it took persistence and it took flexibility to be able to do that. We were also fortunate, and I do say fortunate in this case, because marketing needed to be a little bit boots on the ground early on to understand signage needs and some other pieces that we were going to have to change relatively quickly according to our LOA or letter of agreement. So we actually got to go up and visit. And there were really strict parameters around who we could talk to and what we could say, right? This was still an intent, right? It wasn't an official acquisition. There was still a chance it wouldn't be approved. There was still a chance it wouldn't go through. So we needed to be very light touch with it, but it was so helpful to just see what the current state was up there and what the experiences were like. If you get an opportunity to do that, I would greatly encourage you to do it, obviously within the bounds of the legal frameworks that you're obligated to. But there was such an opportunity to be able to see, okay, this is how this market is the same. This is how this market is different. This is how we need to think about positioning ourselves for these folks, because again, they are coming into this situation, not knowing who we are really, and coming at it blind as well, but just from a different perspective. So really kind of had to take the opportunities that we could, the content that we could, and in some cases, use our evaluation of the situation to determine what a piece of content needed to say. And if we needed to change that later on, we absolutely could do that, right? But what was important was making sure that we got all of that content, because on July 1st, it was going to go away. But
Yeah,
I'd be curious, yeah, to hear your thoughts, Larissa, on that.
yeah, I,
Yeah.
I remember we had to do a lot of fishing, and not like a lot, but there was like, I think it was, I want to say it was the location pages or something like that,
Yeah.
that we didn't have that information. So we again had to go to like the Ascension and basically pull that content ourselves and hope that it was as accurate as possible. But then also just doing some investigation of like what was possible. Like I know we had questions on like, can we programmatically migrate some of this content within Yext and things like that. It's so figuring out those things that you may not be able to answer on the fly or your team might not be able to answer on the fly, and kind of doing our due diligence on the back end to see what was possible to make that as smooth as possible. Because when you're working with like multiple systems that you need to integrate content from one to another, like they naturally don't speak to each other, right? So anything that we could do to make that a little bit easier, I think, was our biggest task at hand, outside of, again, that game of telephone. I remember that very well. You're like, it's day 3, I still haven't heard back from them, like I'm hoping to get an answer from you soon. So just kind of having to pivot to the work that we could work on at that point, if we were roadblocked on anything. So yeah, fun stuff. It was a fun project. I really enjoyed it, and I honestly appreciate the opportunity to kind of get to reflect back on this, because to your point
Yes.
earlier, you don't really get that moment of, wow, we did this thing. So it's great to kind of see it all packaged up in this webinar. um,
Absolutely.
So I think we're good to pass it back to you, Daniel.
Larissa and Kate, I'm sure the audience joins me in thanking you for that terrific discussion. And thanks also to everyone in our audience for taking the time to join us today. Please note, we'll be sending out a link to the webinar recording, so watch out for that in the next few days. That concludes today's program. We hope to see you at future forum webinars, as well as the 31st Healthcare Marketing and Physician Strategy Summit, May 3rd to 6th in Salt Lake City. Please visit the forum website at healthcarestrategy.com to learn more. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.